Hello, Health Stream. How you doing? I wanted to give you an update on the Floxy issue, the fluoroquinolone antibiotic toxicity discussion. I learned some new things. I didn't read a whole lot. There is a whole lot out there on the internet, but I didn't read a whole lot because you can go down that rabbit hole and it can get very disheartening. So I read enough for me, and I need to share it with you because it's absurd that doctors are still prescribing this medication for non-threatening ailments. And I'm sure they're still prescribing it to your family, and God forbid they're prescribing it to your kids. And you don't know, and maybe they don't know. But please tell everyone you know not to take these medications. And I will tell you things that are going to scare you, so hopefully you do that. And then also give you some additional information on what to avoid. And, oh, the other video is here or here, wherever the cards are. And I'll include that link so you can go back, because I talked about the whole list of the medications, which I may or may not mention again today. But this is just the update. So if you want to see the first video, go to that card. Anywho, you can find these warnings right on the FDA.gov website. If you Google Cipro toxicity or Cipro poisoning, there's a plethora of information. A lot of it's hard to find in one place. These reports come out over the course of years and they seem to just be disparate. There's no one source of information. I haven't found any place where I can just look at Cipro and then look at all the warnings under it. It may be out there, but I haven't been able to find it yet myself. So I'm going to run you down a list of the warnings that I found. These warnings are on FDA.gov, and the list that I used was actually from drugs.com, but even that wasn't updated. There was another warning that was given in December of 2018, so this website was probably written before that and not updated. I think that was the last warning, which is terrifying. You'll hear about it. Ugh. Okay, 2013, the FDA put out a warning that fluoroquinolones can cause permanent nerve damage. Irreversible permanent nerve damage. Well, here are the brand names. Avelox, Cipro, Cipro Extended Release, Factive, Levaquin, moxifloxacin injection, and ofloxacin. It sickens me. And there's like 60 generic forms. Just tell your doctor I will not take a fluoroquinolone. Now, in May of 2016, there was another warning of, this is where the big one started, tendon issues, muscle weakness, joint pain, nerve damage, central nervous system damage, confusion, and hallucinations. In July of 2016, because if that wasn't bad enough, you needed to update it 2 months later. Tendon rupture, tendinitis, myasthenia gravis, I don't know what that is, peripheral neuropathy, cardiac, dermatologic, and hypersensitivity reactions. That seems probably a little bit more tame than it is. Reactions. 2018, July of 2018, low blood sugar, mental health issues, disturbances in attention, disorientation, agitation, nervousness, memory impairment, and delirium. yeah, these are the side effects. But you know what? Enough people had these side effects for them to put them on the label. Do you want to be one of those people? No. December of 2018. Here's the fun one. Ruptures and tears of the aorta. Ruptures and tears of the aorta. You know, that's the vein. Goes to your heart. It's probably not good if it ruptures or tears. So, as I did my research, I was nauseated and terrified because it just seemed like a total nightmare that you get this thing and it doesn't go away, and they don't know why some people get it and why other people don't. Yeah, advise patients to seek immediate medical attention for any symptoms associated with aortic aneurysm. I mean, Jesus, God. Just because you had a UTI or a sinusitis, a head cold, give me a break. It's awful. It's awful. Anyway, there's a term for people that have this. They're called Floxies, Floxie. So because these poor people they don't really find answers, and they're just tormented with these conditions until they finally figure it out, and then they learn, oh, there's really nothing you can do about it. If they're not already dead or disabled or delirious. Anyway, so I found this website called Floxy Hope. And there are wonderful recovery stories on, I didn't read all of them, I read the one. And it's probably the most popular one, it's the first one. And Lisa's story, floxyhope.com. And she talks about her experience with this. She was young. It's very sad. This woman hiked like 20 miles a day, and now she can't hike more than a couple miles, but she's elated to be able to do that. It's pathetic. So she had a urinary tract infection. She took 6 pills, 2 a day for 3 days. So she went back to the doctor because she didn't think it was gone. He gave her another one, and the infection subsided. Well, why? Because she was probably immune, the bacteria was probably immune to the Cipro to begin with. So she shouldn't have been prescribed it, just like I shouldn't have been. Even regardless of the warnings. Her condition did not warrant the Cipro being prescribed. It was prescribed before the test came back. Now, she said she had taken Cipro a year earlier for urinary tract infection and had no noticeable side effects. But now that she thinks back, she may have had some. The real problem comes when she had PMS and she took ibuprofen. And that seems to have kicked off this problem. So what she says is that NSAIDs, so here's aspirin. I had 2 bottles of this and 2 bottles of baby aspirin. Gave them away. I'm going to give this away. I don't know, $20 worth of aspirin. Got to give it away. I took aspirin because that's what I take. I thought aspirin was just, good old aspirin. It's been around forever. Doesn't hurt you. Tylenol is supposed to be bad for your liver, right? So we'll take aspirin. No, can't do that either. NSAID. NSAID it's on this. Says it somewhere. I know it said it somewhere. Non-steroidal anti-inflammatory drug. So ibuprofen and aspirin. That includes. So if you've ever taken Cipro or any of these fluoroquinolones, ever, do not take NSAIDs, and also do not take steroids. Now, keep in mind, I'm pretty sure that after I had the Cipro, I took some aspirin. So maybe that's why I'm starting to have these problems. Which, by the way, the update is the symptoms are starting to subside and things are getting better. So I feel very relieved. The water is starting to leave. My finger is getting much better. It doesn't really hurt that much, and it's not very bloated. So thank God for that. Thank God for the acupuncturist and the chiropractor that I have. Just blessings. Thank God that I have access to them, and I know about them, and I'm not dependent on our typical medical system. Because when I had originally was diagnosed with trigger finger because of the finger, okay, well, what is it? How do I fix it? Oh, we'll shoot steroids in it. So the Cipro gave me the problem, the aspirin made it worse, and then they're going to shoot something in my hand that's going to make it even worse. This is a terrible crisis. The crisis is not just that medical care costs too much. It's that it's ineffective and it's actually makes you sicker. I can't even get over it. And I know the people in the medical industry, by and large, doctors and nurses, go into it because they want to help people. Unless I heard about this podcast called Dr. Death. Apparently he went and gave people surgeries to make them worse so that he can give them more surgeries so he can make more money. And everyone's like, you gotta listen to it. I'm not listening to that. How can you listen to that? What a horrific thing. Now, I think that's definitely the outlier. Most of the industry is not that bad, but you gotta worry about yourself. I mean, this is terrible. So, and eventually she said that, let's see, I'm looking at this website because there's so much information here, I just have to. And unless you face this issue, there's no need to go look at this website, but at the same time, you need to, people need to know. You need to be warned. So, she took the Cipro, she took the ibuprofen, and so her legs started to itch. She broke out in hives. She went to the doctor who gave her Benadryl, which gave her more hives. Her hands and feet swelled to the point that she couldn't use them anymore. It was painful to walk and stand. She went back to the doctor and was put on prednisone, which I think is a steroid, suppressed the swelling and calmed the hives. But then her left leg went weak. For the next weeks, the following symptoms got worse and worse. They include weakness in my legs, I could barely walk, tightness of the tendons in my legs, inflammation, possibly possibly tears in most of my tendons, loss of use of muscles, loss of strength, brain fog, I couldn't think straight, loss of memory, loss of peripheral vision, black floaters in my periphery, loss of appetite and weight, loss of flexibility. I went from being able to do yoga several times a week to being unable to sit with my legs curled up under me, loss of balance, severe loss of energy, dry mouth, anxiety, pain in my feet, loss of reading comprehension, loss of social skills and connectedness. I felt like I had aged 20 years in just a week or two. So she said they thought she had an autoimmune disease. They thought she had rheumatoid arthritis. They ran all of these tests on her. Couldn't figure out what it was because none of the tests were coming back. Everything was normal. So she didn't know what it was. And eventually, she was desperate for a treatment. Traditional medical doctors I saw provided no relief, treatment, or healing. I started seeing an acupuncturist. And actually, it was an acupuncturist that told me this is probably what I have. So that gave her some relief. It stabilized her and allowed her to start getting back to health. She connected the symptoms to Cipro. And she was sick for about a year. And even after that year, she said she's about 99% better, but not 100% better. She still can't do physically what she did before this happened to her. I'm not a doctor, but this is the list of things that helped me. Number one, time. Everything gets better with time and hope. So her story is very motivational. Just be patient with yourself. Next, avoid NSAIDs and steroids like the plague. So please, you've probably taken one of these antibiotics. Your family have probably taken these antibiotics. Please never take an NSAID or a steroid if you can avoid it again. NSAIDs and steroids are the drugs that are most commonly prescribed to treat fluoroquinolone toxicity. This is because the combination does not always cause a toxic reaction. The toxic reaction of combining them can occur even when the drugs are taken weeks or months apart. Doctors in the medical profession don't acknowledge fluoroquinolone toxicity, and so they don't look for contraindications. And because many of the symptoms are treated with NSAIDs and steroids, treating symptoms does not treat the problem. That's what we typically do in our society. We treat symptoms, and the symptoms go away, but the problem is still there. You have to find the root of the problem. Someone said to me, maybe your finger issue is arthritis, and you could take a steroid injection for that. And I said, thank you. That will treat the symptom. It won't solve the underlying problem. And her response was, well, arthritis is a permanent condition. There's nothing you can do about it anyway. Oh yeah? Watch me now. Hey. Yeah, no, that's unacceptable in my life. That is an unacceptable response. If that is the way that you look at your body and that's what you accept, that's what you're going to have. I'm not putting up with that. No way. No how. Why is this happening? What's the root cause? How do I fix it? That's the only option. This is not staying like this. This is not the way my body is supposed to be. This is happening because something went wrong, and I'm going to fix it. I'm not going to inject things into it that are going to make it worse. And don't put that on me. Don't tell me this is permanent and won't go away. Don't tell me that. You don't know. You'll see when I fix it. Anyway, the pain-killing qualities of NSAIDs and the swelling reduction qualities of steroids make them the drugs of choice for treating many of the symptoms. Don't take them. Yes, the symptoms suck. And that is why I took the aspirin, because I thought it would help with the inflammation. I had no idea. I suggest taking non-NSAID over-the-counter pain medicine like acetaminophen, Tylenol for pain, or marijuana, and antihistamines for swelling. So I did try some antihistamines, and that did seem to help me. So I'm thankful for that. Often, this is misdiagnosed as an autoimmune disease or rheumatoid arthritis. Many of the drugs that are used to treat rheumatoid arthritis are NSAIDs. Don't take them. The medical medium talks a lot. I haven't seen anything that I would love. Medical medium, if you're watching, please do something on this topic. I'm going to write down, I need to message him, because I meant to do that. And ask him to please put something out on this. And, not that he would get the message, but you never know. I don't know. But I looked for any advice that he had on this. He didn't. But there is advice on rheumatoid arthritis if that is a problem for you. He does have things that you can do for that. He has a lot of information on that, which is good. Next is acupuncturist. I credit my acupuncturist with saving my life. And to be honest, I don't know that my acupuncturist saved my life, because I think a lot of the things that I've been doing for my health already helped to minimize this reaction. Praise be, knock on wood, praise God. But certainly helped me to not think that I was insane, right? Because what happens is that you have these symptoms and no one can help you. And like she said, all the tests came back, she was healthy. So she must be healthy, because if we don't have a test for it, that means it's not a thing. yes, I paid a lot of money for my degree and I'm right. I mean, come on, give me a break. Oh, so insane. Just because we don't know about something means it doesn't exist. It's so frustrating. But anyway, so for someone to give you an answer and say, and sometimes it's not good to get diagnosed because it's like you have this and now you have a label and now you own that label and you're living that label. But for someone to just say, here's what we think it is and here's how we're going to work on it is sometimes can be a very relieving feeling, and that can just make you better to begin with. So acupuncture, both the acupuncture needles and the herbs gave me immense relief. I just started acupuncture because of my finger and I am in love with it and I can't say enough about it. So find a good practitioner, give it a shot. Supplements. I've taken more supplements than I can remember. 90% of them had no noticeable effect on my health. Here's a list of supplements I think helped me. Iron, magnesium, zinc, chlorophyll. So most people are deficient in those anyway. Right now I think I'm a little slightly deficient in iron, but I think I've always been, which is weird because I eat a ton. I think I said it on another video, a ton of red meat. So I thought I was high iron, but I just went to my chiropractor and she said, no, you're reading it wrong. It's really low iron. So that's weird. But, all right, I'll go back to eating red meat. Not a problem. I don't know. I don't want to take a supplement. But I do take magnesium, I do take zinc, and I take many things that have chlorophyll in it. She also takes fish oils, resveratrol, which I take, a probiotic, which I take, a joint supplement, coenzyme Q10, B12, chlorella, glucosamine, brewer's yeast, and some other supplements. Recommendation number 5, meditate. Meditating helped me to gain compassion for myself and my situation. Meditate. I learned to meditate through taking a class called Mindfulness-Based Stress Reduction that was offered by my health insurer. God bless them for offering that. Yeah. It was an excellent class based on the work of Jon Kabat-Zinn. Many Buddhism centers offer mindfulness-based stress reduction or meditation 101 classes. You can also, I recommend TM. It's expensive, but they have a sliding scale. So if you can't afford it, they'll adjust it based on what you can afford. Get off the internet. So she didn't get involved in a lot of these forums and discussions because, yes, people are trying to be supportive of each other, but they also can become a rabbit hole of complaining, right? And then you're just in this environment of everyone who's sick and complaining. And that's that. Excuse me. That's not good either. So you want to keep positive at all times. Number 7 is diet. She stopped drinking. It seemed like an allergic reaction. Oh, her body was going haywire. So she didn't know what it was. She thought it was an allergic reaction. So she stopped eating all allergenic food, gluten, dairy, soy, kosher, anything non-kosher or anything spicy, alcohol, caffeine for a month. She only ate vegetables and organic meat. So I think since then she's added more food to her diet, but still eats relatively clean. Yeah, I noticed that I feel slightly worse than normal when I consume sugar and or caffeine. Oh, that's interesting, because I just ate sugar and I feel a little tired. Yeah, I've heard good things about the benefits for Floxies of eating broccoli and other cruciferous vegetables. I love broccoli, so I eat it a lot. Unfortunately, I haven't noticed it makes me feel better. The only food that makes me feel noticeably better is beets. What's the one food that I dislike immensely in the world? Beets. Just boil them and eat them. I don't think I could. I haven't eaten them since high school, but maybe I'll try. So swimming is her number 8 recommendation. She said it's very therapeutic for her. Pilates, a lot of core work. So she started doing that 7 months after this happened to her. And You know, I think she had done yoga before. I don't know why she didn't go back to yoga. Maybe because of the tendons. But I feel it gently stretching my tendons, muscles, and ligaments to heal and return to close to their pre-floxing capacity. I've been doing yoga during this, and not as much as I have been because I'm tired, but I definitely feel much better afterwards. Healing arts, so she loves to dance, so she danced. And attitude. You're not crazy, you're not stupid. Don't kill yourself, have hope, you will get better. Do something, anything to work towards healing every day. Try not to compare yourself to how you used to be. Because that shit is over. Hopefully not. Hopefully you can get that back there. Look, I'm a perfect example of the fact that you can change your life so dramatically. I can't even say. It's possible. You never know it's possible. Try not to identify yourself as sick. You will have bad days and they will pass. Don't quit your job. Try to maintain your life. It's not your fault. It is not your fault. So she goes on to say how she is now. She's better. She's not perfect. So I wanted to share that with you. Floxyhope.com. That way, you know, I mostly want to warn you, please, please, please don't take these. And if you did, don't take NSAIDs and don't take steroids. And please tell everyone you know to do the same. This is terrifying. And then hopefully word will get out and they won't sell as much and they'll lose money and they'll either do more research on it or stop selling them. I mean, this is awful. I cannot believe I didn't know about this. And I can't believe my doctor didn't know about this either. Anyway, that's what I have for you today. I hope it helps you to become more aware. Peace out.